Greetings. I'd like to spend a little bit of time talking about some interventions for those who work in the field where they may be exposed to other people's traumatic experiences, such as in child sexual abuse investigations or child abuse intervention or therapy, or work in law enforcement or emergency rooms where people are exposed to a variety of traumas that people experience from being victims of sex crimes. We already mentioned the concepts in a previous video on vicarious trauma, secondary traumatic stress, and compassion fatigue, and also another video I presented on post-traumatic stress disorder. In this one I'm focused on some interventions, and a lot of this comes out of our book on child abuse and neglect by myself and also Dr. Barbara Mera, that we published in 2001 with Allen and Bacon publishers. Basically, we want to first of all understand some of the risks, but then what to do in the situations. But also prevention is very important as well. So these are things that we can do not only to prevent but also to intervene. And my philosophy is the earlier we intervene, the better. So here's some recommendations. First, we recommend that you work with other professionals in collaborating on these cases. That the interdisciplinary teams can work together to reduce stress and burnout, and also possibly reduce secondary traumatic stress through case discussion and consultation and obtaining feedback and support on difficult cases. Also, stress management strategies and techniques can be helpful, such as breathing exercises, or for example progressive muscle relaxation or meditation, visualization, hypnosis, and other cognitive behavioral training. That can be very helpful as well, and something that we recommend someone practices on an ongoing basis. Also very important is obtaining appropriate supervision from someone who's been working in the field a while and understands what's going on and how to avoid some of the pitfalls and perils of working in this field. Often having weekly meetings with another professional who has been working in the field for a while, and also having consultations with that professional on difficult cases can reduce some stress and strain. Also, it's very important to recognize if one believes that they're beginning to feel the effects of traumatic stress from working with clients, that they seek counseling. And of course that can be very difficult if someone is a counselor or in law enforcement. They often try to avoid going to counselor. Again, the sooner the better. I think it's much easier to treat the beginnings of these stress responses than to wait till things are totally out of control and there's already been much damage. So I think that's important to recognize, that counseling can be extremely helpful and an invaluable part of one's work. Also, developing an interest outside of the particular area where you work, and taking time off from that work, and not focusing on that work when you leave, in that sense. Also, continuing education to find out what's going on in the field, new findings regarding traumatic stress, for example, and now we can communicate with other professionals via internet and get new updated information on research and treatments, and also we can take continuing education courses and work with other colleagues that are in the field. Also, focusing on time management, something that you would have to do with management as well, to make sure that you're not being overworked with cases, and that you have enough time to adequately address each case. Developing a support system outside of the work environment can be very helpful, and maybe even having a varied caseload can prevent some of the problems of seeing similar types of cases that may increase one's risk of burnout and secondary trauma. It's also very important to look at the environment and the safety of the environment where one works, and to make sure that policies are implemented that protects not only the clients but also the workers. The organization should recognize the risk for stress, burnout, and traumatic stress reactions, and should incorporate this into hiring practices. It's my opinion that it is ethical and responsible for an organization to say these are some of the risks that you are getting into when you enter this field. People should know what they're getting into. And I also highly recommend job shadowing and internships when appropriate to kind of see. For example, I once had a student who worked for 3 months as an internship on a child abuse unit, came back and said, this was a total failure. I don't want to do this work. And I said, no, this is actually a very good success. You don't want to do this work. So she found out ahead of time that she didn't want to work in the child abuse and neglect field. And I think that was very helpful. That is before obtaining employment and working in the field a while and then deciding that. Remember, burnout is not the same as vicarious trauma, and I think it's easier to treat burnout than it is vicarious trauma, but burnout can be very problematic as well. It's important to know one's own history and how their own history may affect their work in the field. And I think that the real important thing to take home with all this is to recognize that anyone can be affected by traumatic stress reactions, and everyone should take this very seriously, and organizations should take this seriously, and then again, this should be part of ongoing training and testing and supervision, and I think that may help to decrease some of the problems. And finally, I would have to mention that when someone does get burned out, or someone is suffering from secondary traumatic stress, or someone has basically had enough of working in the field, then it may be time to get out of the field and to work either different cases or find a different occupation. That is certainly one of the options and very relevant as well. Okay, I thank you, and good day or good night.